Hi everyone, welcome to this very special video for Rainbow Baby Week. I have Professor Alex Heazell here, who has done some amazing work around stillbirth and pregnancy after loss. And we're going to be talking about trying again after loss. And I'm just going to pass over to Alex now to introduce yourself, please, and a bit about your work and your connection to pregnancy after loss.
Um, Thanks ever so much, Amni. As you said, my name is Alex Heazell. I am one of the professors of obstetrics at the University of Manchester, which means I spend half my time doing research and half my time caring for mums, babies, and their families. And in particular, I'm the clinical lead for the Rainbow Clinic, which originated in Manchester and specifically provides specialist care in pregnancy after loss.
Thank you. So yeah, I mean, you're a bit of a, well, I don't know if pioneer is the right word, but you're kind of up there when it comes to the way that Rainbow Clinic started in the UK, aren't you? So it's
Yeah.
it's really incredible to be able to speak to
Mm.
you today. But what I'd like to ask is, thinking about research and trying again after loss. So what are some of the areas that research has uncovered about what parents can do when they're trying again after loss to help improve their chances of preventing a further loss?
Okay. I think that's a really important question. So I guess there's a couple of things. The first is that um, our research in this area goes back probably 15 years, and some of that is looking about, the need and the imp for extra support in pregnancy after loss. We really recognise, it can be really challenging for parents for lots of different reasons. Um, in terms of when we've had mums coming through the Rainbow Clinic, we've got really good information now about the recurrence risks of certain conditions. And actually, um, the one of the most important tests you can have after your baby dies is to look at the placenta and what was going on in the placenta in that pregnancy. And that tells us quite a lot of information about the likelihood of that problem in the placenta coming back. And the really good news about that is that there are quite a lot of those conditions that we can do simple things about. So, for example, if the placental pathology shows something like maternal vascular malperfusion, which is the medical term for when there's not enough blood coming from mum's side of the placenta, then actually we need to do some tests to make sure that you don't have sticky blood. If you don't have sticky blood, then we just need to give you some aspirin and some vitamin D in another pregnancy, and that really reduces the risk of the problem coming back. If you do have sticky blood as well, then the doctor would talk to you about having some heparin injections to keep the blood a little bit thinner. Um, and we've also shown that much rarer conditions, so there's a condition called CHI, which has a very high chance of coming back, is a little bit like organ rejection of the placenta. And we know that we have to treat that with drugs that are similar to those, excuse me, that treat organ rejection. So even under those circumstances, when it's potentially quite a serious diagnosis, there are still things that we can do. Um, and some other really important findings from other groups are things like, what is the ideal time to wait before you conceive again? There's now been a couple of really good, really important studies that show it doesn't really make any difference. So, there are different things going around. You used to wait for 6 months or 12 months or
Yeah, I've
24
heard
months
18
before.
months in there
Yeah,
somewhere,
yeah.
but yeah,
It's none of it is really evidence based. And if you look at the risk of adverse outcome in the next pregnancy, it doesn't make any difference. It's the same in those groups. So it's much more about, have you got the information back from the pregnancy that you lost? So we know what we've got a plan for the next pregnancy. You know, are you kind of you and your partner in a place where you kind of feel able to embark on, another pregnancy because it's, it's a real roller coaster of emotions, and we know that, and we're able to support people. I normally say to people, if you wait until you're not anxious about it, well, you're never going to do it because you're always going to be anxious about it. But it's, kind of, are you in a place where you feel you can get on the roller coaster? Um,
Yeah, a place where you feel like you can manage that anxiety.
yeah. And the last bit of data that we've done that I think is really important is about, are those risks of pregnancy complications, which we know are slightly higher in some causes of stillbirth, is it just the first pregnancy after loss, or is it all of them? And we've found that actually those associations with having small babies or preeclampsia or giving birth a little bit early, they occur even when you've had a live born baby. So we should be providing specialist care for mums in pregnancy after loss in all of their pregnancies, not just that first one. So, you don't magically, after having a live baby, you don't sort of magically just go back to normal consultant-led care.
Yeah. So I guess some of this information about like the placenta and everything is probably easier to do after a stillbirth, but are there any tests and support
Mm.
available for parents who are trying again after earlier, like a miscarriage or
Yeah.
a second trimester loss?
So as with any pregnancy, there's kind of generic advice that we'd always give to people. So not smoking cigarettes, try and optimize your weight, have a good diet, take preconception vitamins and folic acid. So do all the things that you would do for that we know that everybody should do for a healthy pregnancy. We don't forget those just because it's a pregnancy after a miscarriage or pregnancy after the loss of a baby. Um, I think in terms of the tests, it's really important that it's individualized. So I talked a little bit before about the placenta. Um, that really helps us to work out, you know, there are some tests that I would do for some causes of pregnancy loss and not for others.
Yeah,
Um, and and So it's about trying to individualize that. So sort of looking at those data, having a conversation about people's general health, family history, trying to piece together as many different bits of the jigsaw as possible, and then um and having that discussion about what we think the best plan is. So sometimes it's a little bit difficult there is definitely not a one size fits all approach to this. And we know that for both the tests and the treatment, as well as also the support for different families, because different people have got different needs at different times. So,
yeah,
I've met families for whom, they really, really, let's say they had a baby that died at 24 weeks, for example. There are some people that would really like an extra scan at 24 weeks because that tells them their baby's alive at that point in time and, things seem to be fine. I've known other families that has been the last place that they would want to be at that point in time. And so we might then, do a scan the week before. So we've given them some reassurance, but actually they can go and have, some time not in a hospital at that point in their
yeah,
pregnancy. So everybody's a bit different. And I think again, that's trying to have that flexibility around what support is available for parents. Um, we know there's some core things that we need to provide, but then there's also the need to be flexible because everybody's a bit different in their needs.
yeah. So it's really kind of focusing on that personalized and individualized care. Yeah,
Yeah, I think so. And that's something that we know, that should be central to maternity care for everybody. So we're
yeah,
not necessarily trying to make a special case just for bereaved parents, but I think it's that, it's that the personalized care in that context needs to take into account where people are at and the complications that they may have had in previous pregnancies.
thank you. My final question to you is what could you say to support parents who are worried or who have experienced recurrent loss?
Um, so I think there's a couple of really important take-home messages. Um, so the first is that there can be lots of different reasons for experiencing recurrent loss, or thankfully, the majority of people don't have recurrent losses, um, both in earlier pregnancy losses and later losses. Um, so if you've had one, I think the thing to do is to try and make sure that you've had the tests to try and find out if there are any causes. If there doesn't seem to be a recurrent cause, then that's usually really reassuring. Um, and it can be really tricky because there's so many myths out there about, mums not being able to carry boys or can't carry girls or this, that, and the other, that that those myths aren't founded on any science. Um, so um, I would also try and make sure that you talk to someone who is a specialist in pregnancy loss if you can. Within most hospitals, there's somebody who is the lead for um, uh, perinatal mortality, so they should be in a good place to counsel you appropriately. Um, Sometimes, if your doctor locally isn't certain about certain conditions, you may need to be referred to a bigger, larger hospital, um, called a tertiary hospital, such as the one where I work. So I would also say don't be afraid of asking for a second opinion. If you feel that um, you've got questions that haven't been answered or that your doctor can't answer them, then um, it may be worth saying, well, somebody, have you asked somebody else who might be more experienced in this area? Um, from my perspective, um, one of the saddest things is when you see someone who has had a recurrent loss and, you think, well, actually, if only you'd spoken to us before, we could have done something about it, and maybe you wouldn't have had a recurrent loss. And there are conditions, thankfully, as I say, they're rare, but there are some that can cause recurrent loss. Um, so I think there are very few conditions where, we would say to somebody, look, there isn't anything we can do about your cause of loss. And we're working all the time to try and make sure that the treatments that we give are as safe and as effective as possible.
Thank you. Thank you very much. I think that's going to be really helpful for a lot of people who are out there and potentially worried about trying again after loss or just looking for some guidance into trying again after loss. So thank you very much for joining me today.
That's okay. Thank you very much for the invite. And looking forward to Rainbow Baby Week and celebrating all the babies that we've looked after.
Thank you.